Okay, so we've all heard those stories, right?
Mhm.
Where someone pulls through a serious illness and everyone breathes this huge sigh of relief.
Yeah,
But uh, what comes after that?
right.
After everyone's done cheering and the patient leaves the hospital,
Yeah.
what happens on that long road to recovery? It's not always pretty, is it?
No, not always. I think that's what we're really trying to unpack today.
Exactly. The stuff most people don't realize about what it really means to recover from something life-threatening.
Yeah.
We're talking about post-intensive care syndrome,
PICS.
PICS, yeah.
Yeah.
And we've got our expert here
Hi.
to walk us through it. And specifically, we're looking at this 2022 medical review article from the Annals of Intensive Care,
Right.
which you were nice enough to send my way.
Well, it's a good one. It really digs deep into the lasting effects, the consequences of these really serious illnesses, things people should know.
Yeah, totally. And I think what struck me is that it's not just about healing. It's almost like surviving the ICU is just the first hurdle.
It is. It's like, congratulations, you survived, but now you've got this whole other battle ahead of you. And it can be just as brutal, if not more so, than the illness itself.
And it's way more common than people realize, I think.
Way more.
So we're talking like what weakness that just lingers for months, this brain fog that people talk about.
Oh, absolutely. See, PICS, it's not just one single thing. It's this whole cluster of issues that can hit you physically, mentally.
Have a shebang.
Yeah, the whole shebang.
So, all right, let's break this down a bit. Let's start with the physical stuff. Because, I mean, obviously, recovering from any illness takes time, but this seems different, right?
Oh, it's different. It's not just, oh, I need a week to get my energy back.
Right.
We're talking months, sometimes years of people struggling to feel like themselves, to get their strength back. Imagine trying to go back to work, to your family, even just, the things you enjoy doing, and your body's just not cooperating. It's demoralizing.
Oh, totally. And then on top of that, you've got, like we mentioned, the cognitive side of PICS, the brain fog, I mean, how do you even fight that?
That's the thing. It's insidious. You're trying to focus, to remember things, to just think straight, and it's like you're wading through mud. Your brain just won't cooperate, and it affects everything, your job, your relationships, just functioning day to day.
It's like your own mind is working against you.
Exactly.
And I know we see this a lot, right? This kind of domino effect,
Yeah.
where if your body's not working right, your brain's foggy.
Mhm.
It takes a toll on your mental health, too.
Huge toll. I mean, think about it. You've just gone through this incredibly traumatic experience, survived a critical illness, and now on top of that, you're dealing with all these other challenges, this feeling of not being yourself. It's no wonder we see such high rates of anxiety, depression, PTSD even in PICS patients.
It's like you've stared death in the face
Yeah.
and won, but the experience leaves you changed.
Right.
And not always for the better. It's heavy stuff.
Uh-huh.
So let's unpack this a little bit. You mentioned ICU acquired weakness, and it's clearly a big part of PICS. So help me understand this. Why is it that our bodies, which are, let's face it, pretty incredible at healing, why don't they just bounce back quickly after something like this?
It's a great question. And what's fascinating is that the muscle loss we see in the ICU, it's not just from being laid up in bed.
Right.
There's this whole other process going on, this biological shift where your body basically says, all right, we're in survival mode, time to scavenge for energy wherever we can find it. And your muscles,
Easy target.
prime real estate, it's called catabolism, your body breaking down muscle tissue for fuel.
So your body is literally consuming itself to survive.
In a way, yeah. And as if that weren't bad enough, you've got inflammation.
Right, because critical illness, that's a recipe for inflammation all over.
Exactly. And that inflammation messes with everything, including how your muscles normally repair and rebuild themselves. It's like a double whammy.
Okay, so that's why the muscles waste away in the first place. But what's weird to me, what I don't get, is why, once the danger has passed, why doesn't the body just kick into overdrive and rebuild?
You'd think so, wouldn't you? But for a lot of people, it's like their body doesn't get that memo. It's stuck. Doctors call it anabolic resistance, where even with good nutrition, even with physical therapy, the body is just resistant to building new muscle.
So you're saying even when you're doing everything right, your body might not cooperate.
For some people, yeah. And on top of that, it's not just about the signals to build muscle. The actual machinery inside your cells, the mitochondria, those little powerhouses, they get damaged during critical illness. So now you're trying to rebuild, but you're low on energy.
It's like trying to run a marathon on an empty stomach.
Worse, it's like trying to run that marathon on a dying phone battery.
Okay, yeah, you're not getting very far with that.
Exactly. And then to add insult to injury, you've got these cells, satellite cells, that are normally involved in muscle repair.
The repair crew.
Right. And they're often depleted, not functioning properly after a critical illness. So even if your body wanted to rebuild, it doesn't necessarily have the workers to get the job done.
It's like a perfect storm of obstacle.
It really is. And I think what people need to understand is that this isn't just about, lifting heavy things.
Oh,
This
no.
is about getting dressed. It's about playing with your kids. It's about being independent. All of that is affected.
It's your life.
It is. And it's something we need to be talking more about.
Awareness is key.
Yeah.
Absolutely. And that's, I think, what we're trying to do here, because it's not just about the physical, right? We haven't even touched on what this does to the brain.
Oh, the brain. That's a whole other story.
Yeah. So we've talked about the body, but the brain, oh boy, the brain, that's got to be a huge part of this whole PICS thing too, right? Because surviving is one thing, but what about like your mind? What about the invisible damage?
You're hitting the nail on the head. The brain, it's amazingly adaptable, but it's not invincible. It takes a beating during critical illness. And one of the biggest warning signs we see is delirium.
Delirium. Okay, yeah, that makes sense. So for people who don't know, delirium, we're talking about that state of confusion some ICU patients experience, right?
Exactly. They're disoriented, sometimes even hallucinating.
Right. And I always figured, well, that's the meds or just being so sick, but it's more than that.
It can be. See, delirium, it's not just a side effect, it's a serious medical condition. It means the brain's not functioning right. And while most people snap back as they recover, there's more and more evidence that delirium in the ICU, it can have lasting effects on your thinking, even after you're out.
So what happens in the ICU doesn't stay in the ICU when it comes to your brain.
Yeah.
That's scary.
Yeah. There's a strong link between having delirium during a critical illness and then having cognitive problems later on, even when you factor in things like age or other health issues.
So it's like a red flag. Delirium, watch out. Your brain's been through something. It might be more vulnerable down the road.
Exactly. And again, like we talked about with the muscles, inflammation is a huge part of the problem.
Right, because it's not like the illness itself always attacks the brain directly,
Right.
but the body's response to it does.
Well, exactly. That inflammation, it gets everywhere, including your brain. And during a critical illness, the blood-brain barrier, which normally protects your brain, it can get leaky.
Leaky brain, great.
Yeah, so those inflammatory molecules, they can sneak in.
And they wreak havoc.
Oh, yeah. Disrupting brain chemistry, potentially even damaging brain cells.
So even if you survive the initial insult, the aftermath can still mess you up.
It's like you win the battle, but not the war.
Ugh. Depressing, but important.
And, researchers, they're looking for ways to predict who's most at risk, right? So they're studying these things called biomarkers.
Biomarkers like what, clues in your blood or something?
Yeah, things like NSE and S100s. These are proteins released by damaged brain cells. So the thinking is, if we can spot these early on,
You can intervene.
maybe. It's still early days, but that's the hope, personalized treatment to protect the brain.
Wow. That's like next level stuff. Okay, so we've got to keep an eye on the brain. But let's talk about the immune system for a sec, because that's another thing that just gets totally wonky with PICS. And it seems so counterintuitive, right? It's like you'd think you survive this terrible illness, your immune system must be like supercharged now, right?
Yeah.
But it's the opposite.
It's almost like the immune system itself has PTSD. It's been through the ringer, and it comes out the other side, off balance.
Off balance how?
So think about it. Critical illness, especially sepsis, which is a whole other can of worms.
Right. Basically, your body's having this extreme, life-threatening reaction to an infection.
Exactly.
Uh-huh.
So with sepsis, your immune system goes into overdrive. But then it doesn't always switch back to normal.
So you're more vulnerable to getting sick again.
Yeah, it's like it's confused and it can't fight off infections as effectively.
Okay, so walk me through this. What's happening at, like, the cellular level to cause this immune chaos?
So one of the culprits is this group of cells called myeloid-derived suppressor cells, or MDSCs.
Flashy.
Right? Normally, they're good guys. They help dial down inflammation. But in PSCS, they can go overboard and actually suppress the immune response too much, making it harder to fight off those infections.
So they're like overzealous peacekeepers who end up disarming the entire army.
That's a great way to put it. And then on top of that, you've got lymphocyte depletion. Lymphocytes are your white blood cells, your infection fighters.
The front line.
Yes. But during critical illness, their numbers plummet, so your immune system is literally losing soldiers.
So it's like you've got these overactive peacekeepers shutting things down, and not enough actual fighters left to deal with the real threats.
It's a recipe for disaster.
It's a mess.
Yeah,
And the inflammation, that just makes it all worse, right? Like a vicious cycle.
exactly. It's complex and it's frustrating, but thankfully, researchers are on the case trying to understand it better and develop targeted
I'll
therapies.
get to do better. Right. All right, so we've talked about the brain, the immune system. I know PICS affects specific organs too, right? Like, what about the kidneys? What happens to them after something like this?
Oh, the kidneys take a beating.
Uh,
Acute kidney injury, AKI, it's a common complication, especially for those folks who end up in intensive care.
AKI, so that means your kidneys just suddenly stop working right.
Pretty much. Sudden decline in kidney function. It could be caused by a bunch of things, drop in blood pressure, infections, certain meds, even dehydration.
So it sounds like one of those things, it's like, oh, this is temporary, it'll clear up, but it's not always temporary.
That's the thing. We used to think it was a blip, but now we're realizing AKI can have long-term consequences.
Meaning, like, you could end up with chronic kidney disease, CKD, down the line.
It's a real concern. You see, kidneys are good at bouncing back, but sometimes that repair process, it goes a bit haywire.
Haywire, how?
Well, instead of healing properly, you get this excessive scar tissue. It's called maladaptive repair. And that scar tissue, it messes with the kidney's ability to filter waste and fluid from the blood,
So the filters are shot.
basically.
Yeah.
And not just that, the blood vessels in the kidneys, those can get damaged too. And when they repair, they often form abnormally, so you've got blood flow problems on top of everything else.
So the plumbing's messed up too.
It's a bad situation. And what's even more concerning is that AKI, it's not just a kidney problem. It can trigger problems in other organs too. Heart, lungs, even the brain.
So it's like a domino effect. One organ goes down, it takes others with it.
It's a systemic shock to the body.
Man. All right, so we got to protect those kidneys. What about the lungs? They're obviously on the front lines with critical illness too. What's the long-term impact of something like ARDS, acute respiratory distress syndrome?
ARDS is rough. Basically, your lungs are filling up with fluid, making it really hard to breathe. And while a lot of people do recover their lung function, many are left with long-term breathing difficulties.
Even if the damage isn't visible on a scan or anything.
Exactly. They might have what's called reduced diffusion capacity, meaning oxygen doesn't get from the lungs into the blood as efficiently.
So even just walking up a flight of stairs, you're going to feel it.
And some people develop restrictive lung disease, where you get this scar tissue, fibrosis, that stiffens the lungs. It's like trying to breathe with a tight band around your chest.
Ugh, that sounds awful. So it's not just about the physical limitations, it's the impact on your quality of life.
Absolutely. People with ARDS often have trouble exercising, working, even just socializing because they're so short of breath. And that can really take a toll on their mental health, too.
Right, because if you can't breathe, you can't really live E. Okay, so we've covered a lot with adults here, but what about kids? I mean, their bodies are still developing. Surely PICS is different for them.
It is different. PICS in children, or PICSE, is its own thing. The good news is that kids seem to be less likely to have that severe muscle weakness that we see in adults.
Really? Are their little muscles just tougher?
We don't know for sure, but there are some theories. Maybe their nerve cells are more resistant to damage, or maybe they have higher levels of these growth factors that help with muscle repair.
So they've got a little more bounce in their step.
Something like that. But, and this is important, that doesn't mean PICS isn't a big deal for kids.
Right, because their brains are still developing too, and we talked about how delirium can affect the brain long term.
Exactly. And studies show that kids who have delirium in the ICU are way more likely to have cognitive problems, later problems with attention, memory, learning, all that stuff that's crucial for kids to thrive.
So their little brains are vulnerable. And I mean, just imagine going through something like that as a kid.
Yeah.
The psychological impact alone.
It's huge. Nightmares, flashbacks, being afraid of hospitals and doctors, it can really shake their sense of security and well-being.
So they need extra support. Are there like specific therapies that can help kids with PICS?
Absolutely. Therapy, support groups, even just having a really supportive and understanding environment at home where they feel safe talking about what happened.
It's about giving them the tools to process what they've been through.
Yes, and to reclaim their childhoods.
Okay, so we've covered a lot of ground here today. The
Yeah.
biological nuts and bolts of PICS, how it affects people's lives, what it means for kids. It's a lot. But honestly, even though it is a lot and kind of overwhelming, it's kind of empowering in a way, don't you think? To like actually understand something that affects so many people, but nobody really talks about.
I agree. We've got to drag this out into the open because you know what they say. Knowledge is power.
Right. And maybe if more people knew about PICS, we could actually do something about it, you know? Think about it. We're getting better and better at saving lives in the ICU, which is amazing. But
But that means more people are surviving to live with PICS.
exactly. So we're kind of shooting ourselves in the foot. I mean, we're not ready to deal with a long-term fallout, right?
100%. We can't just focus on keeping people alive in the hospital. We've got to make sure they have the support they need after they leave, the rehab, the therapy, all of it. It's a long game.
It is. Because surviving a critical illness, it's a victory, for sure. But,
But it's not always a fairy tale ending.
right, it can be the start of a whole new set of challenges.
Yeah.
And we need to be honest about that.
Yeah.
You know, we need to prepare people and their families for what to expect.
And not just prepare them, but actually provide the resources, the support systems, so they don't feel so alone.
Because it's not just about adding years to life. It's about adding life to those years, right? Making sure those years are actually good ones.
Well said. That's what it's all about.
So to everyone listening, if any of this has resonated with you, if you're dealing with PICS yourself or know someone who is, just know you're not alone. There are people out there who get it, who can help. Don't be afraid to reach out.
There is hope. And the more we learn about PICS, the more we share, the better equipped we'll be to support survivors and their families.
Absolutely. All right, on that note, I think we're going to wrap up this deep dive. But keep those brains buzzing, folks. Keep asking those tough questions. And until next time, remember, knowledge is power.